Welcome to The Explainer. I am so glad you're joining us today because we have got a truly fascinating journey mapped out for you. We're going to trace the American dream, starting all the way back from its historical roots and original vision, right up to the very modern systemic roadblocks that are standing in its way today. Specifically, we're going to unpack the towering barrier of medical debt. We've compiled an incredible set of sources to guide us through this, so get comfortable, focus in, and let's unravel exactly how health and wealth collide in America today.
Okay, let's dive right into this. 50%. According to data from Opportunity Insights, which is a research group out of Harvard, this number represents a pretty startling reality. Think about this. If you were a child born in 1940, you had a 90% chance of growing up to out-earn your parents. Upward mobility was almost a given, but for children born today, that number has plummeted to just 50%. It's basically a coin toss. This stark data point tells us that the defining feature of the American dream, that classic upward mobility, is dramatically fading over just a few short generations.
So what exactly does this all mean? How did we literally drop from 90% to 50%? What happened to the American dream? And what specific hurdles are stopping people from achieving it right now? To figure this out, we really need to funnel down from the overarching statistical myth of upward mobility directly into the on-the-ground financial realities that families are facing every single day. To understand the modern barrier, we first have to look at the original vision. The term American dream didn't just appear out of thin air. It was actually coined back in 1931 by James Truslow Adams in his book, The Epic of America. But, as researchers analyzing Adams' work point out, his original vision was deeply democratic and egalitarian. It was all about equal opportunity for everyone to reach their fullest potential. However, as early industrialization and capitalism took hold, they kind of corrupted that ideal. It transformed from a shared societal aspiration into an individualistic race for material wealth accumulation.
Section 1. The modern barrier, underinsurance and medical debt.
So if that original dream got hijacked by wealth accumulation, what happens when a system actively strips your wealth away? Today, the big barrier to that dream isn't just a lack of initial income. It's the catastrophic, wealth-draining costs of the U.S. healthcare system that can absolutely trap families in financial ruin. Now, you might be thinking, doesn't insurance fix this? Well, actually, our sources remind us that the true metric we need to watch is underinsurance. According to the Commonwealth Fund, 23% of working-age adults in the U.S. are underinsured. This means you have coverage, sure, but your out-of-pocket costs still exceed 10% of your household income, or 5% if you're low income. You are functionally unable to access affordable care, even with an insurance card in your wallet.
And the fallout from that underinsurance? It's honestly staggering. 107 million. That means an estimated 41% of American adults currently carry some form of medical debt. That is an enormous portion of the country. This isn't just some fringe issue affecting a few unlucky individuals. It is a massive systemic crisis baked right into the financial lives of millions of people.
Crucially, while this debt is widespread, the burden definitely isn't shared equally. 56% of Black adults and 50% of Hispanic adults carry medical debt, compared to 37% of white adults. Our sources point out that this disproportionate impact is heavily tied to historical legacies of discrimination, segregation, and redlining. Because of these systemic factors, Black and Hispanic Americans often have fewer savings to absorb a sudden medical shock, which ultimately forces them to bear the heaviest brunt of this debt burden.
Section 2. Geography and the Medicaid coverage gap.
You know, race and income aren't the only dividing lines here. Geography literally shapes your financial destiny in the American healthcare system. And this geographic divide stems directly from a 2012 Supreme Court decision known as National Federation of Independent Business v. Sebelius. That ruling made the Affordable Care Act's Medicaid expansion voluntary for states rather than mandatory, and that created a massive policy flaw called the Medicaid coverage gap. Because the ACA was written assuming everyone below the poverty line would get Medicaid, the subsidies to buy private insurance only kick in above the poverty line. So when states refused to expand Medicaid, they stranded their poorest citizens in a complete coverage void. We're talking about roughly 1.4 million individuals who earn too much for traditional legacy Medicaid, but too little to get subsidies on the ACA marketplace. They are totally uninsurable.
And geographically, this policy dysfunction is incredibly concentrated. A staggering 97% of these 1.4 million uninsurable folks live right in the South, and nearly 3/4 of them are located in just 3 states, Texas, Florida, and Georgia. It creates a highly regionalized breakdown in coverage.
When you look at the data, the real-world impact of that regionalized policy is pretty undeniable. The regions with the highest concentration of medical debt perfectly mirror those states in the South that refused Medicaid expansion.
And, exactly matching that trend, those same regions had the lowest average FICO credit scores in the entire nation. It is a stark correlation between a state policy decision and the direct financial degradation of its citizens.
Section 3. The cascading consequences of medical debt. Let's zoom in a bit from those macro-level maps and see how this builds on a micro level. How does a single medical bill trigger a domino effect of absolute financial ruin? Well, first, an unavoidable medical event happens. Second, because of underinsurance or falling into that coverage gap, massive debt is accrued. Third, that debt goes to collections, completely devastating the individual's credit score. And fourth, and this is where economic mobility completely freezes, employers and landlords routinely check those credit scores. So a health emergency doesn't just empty your bank account, it actively prevents you from renting an apartment or securing a job. It's a vicious, self-perpetuating cycle.
The hard numbers really back up just how devastating this cycle is. 58% of all debts and collections, they're medical. 62% of personal bankruptcies are tied to medical debt. We have to realize this isn't just a minor inconvenience. It is a mechanism that actively drains household wealth, prevents homeownership, halts generational investment, and directly widens the racial wealth gap we talked about earlier.
Section 4. The policy crossroads.
So how do we address this? We are currently standing at a severe policy crossroads. Now, as an explainer, our goal here is to simply look directly at the source texts to understand the two legislative realities that are currently battling over this issue. The approaches to the medical debt crisis from the Biden administration and the proposals from the Trump administration and congressional GOP honestly could not be more different. Looking at our sources, the Biden administration's approach has leaned heavily into expansion and regulation. They utilize the American Rescue Plan Act to enhance premium tax credits, effectively zeroing out insurance costs for low-income families. The IRS also issued rules to fix the so-called family glitch, allowing individuals to seek alternatives to expensive employer plans. And crucially, the Consumer Financial Protection Bureau, the CFPB, issued rules to ban medical debt from appearing on credit reports, directly trying to stop that vicious cycle of credit destruction we just looked at.
On the flip side, the source text detail that the Trump administration and Republican congressional proposals favor deregulation and budget reduction. Their approach includes freezing those CFPB regulations on medical debt. House committee instructions target $880 billion in savings from healthcare programs over 10 years, which would heavily impact Medicaid. Furthermore, proposals suggest letting the ARPA-enhanced credits expire and reverting the 90% federal matching rate for Medicaid expansion back down to legacy rates, which sits somewhere between 50 and 77%.
So, what are the stakes of this policy battle? According to analysis from the Roosevelt Institute, they are incredibly high. Without those enhanced subsidies in federal Medicaid funding, an estimated 4 million people could lose coverage entirely. Millions more would be forced back into inferior plans, dumping them right back into the coverage gap. And as the source notes, this fallout would disproportionately impact Black and Hispanic individuals, ultimately increasing bankruptcy costs across the entire healthcare system.
Which brings us full circle to the question I want to leave you with today. Think back to James Truslow Adams. How does that original 1931 vision of the American dream, a vision deeply rooted in egalitarianism and equal opportunity, align with the modern reality of a healthcare system where geographic and systemic financial barriers so heavily dictate your success? Can a system inherently tied to medical debt ever truly offer the opportunity Adams first imagined? It's a complex, provocative question, and one that requires all of us to keep learning, keep analyzing, and keep exploring the data. Thank you so much for joining me today, and I really hope this explainer gave you a totally new lens on such a critical issue.